Hey friends, I'm Dr. Molly Brinkman. I'm a veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hello, friends. We took last week off because I took last week off because we were on vacation at the beach. We went to a resort called Wild Dunes, which is in South Carolina, which anyone listening who has human children knows that going to the beach with small children is not necessarily vacation. We call this a trip, but it was, we had a lot of fun. And Wild Dunes, it's a cool resort. We hadn't been there for a long stay before. It's been a long time. And we hadn't been there with kids before. Super convenient with kids. We live near Nashville, like I said, so we're in Tennessee. So it was like a 9.5-hour drive. I don't know that it was going to the beach there is worth the drive for us from Tennessee because we just have a lot of other beaches we can get to a lot faster. But yeah, I took the week off from recording because we were at the beach. And this week went back to work. We just had the 4th of July. Hopefully everybody's dogs and cats did okay. And horses with the fireworks. It's been a hard weekend, holiday weekend for a lot of people. There was devastation in Texas. We all know this. If you're listening to this, it's already happened. And it's been, kind of difficult to even hear about. And I can't even imagine what all the people in Texas affected are going through. People have lost their human family. People have lost their pets. People have lost their livestock, I'm sure, as well. So anyway, I just wanted everyone in Texas affected by the floods to know that the rest of us are thinking about you, praying for you, and just so sorry that this terrible thing has happened. I always say on my page or think about when I'm talking on social media about bad things happening, it's like feels sometimes weird to acknowledge one bad thing that's happening on that kind of a platform because so many things happen all the time all over the world. But especially when it's just kind of next door in Texas, so close, or anywhere in the U.S., just so hard to see people going through anywhere in the world, going through hard things. So anyway, the topic this week is not super light, but I am excited about this episode. So I do have a hot take. So we're going to have a hot take before I get into the meat and potatoes of our show. So my hot take is a little bit of a tease for an upcoming episode. I let everybody on my platforms know I am working on an episode talking about breeders, dog breeders in general. This is a huge topic in the animal and vet world. There are a lot of people who feel like dog breeding shouldn't exist, period. And at the same time, there are a ton of dog breeders out in the world who should not be breeding dogs. They're not doing that ethically or responsibly. And this is one thing that has contributed significantly to the crisis we have, at least in the U.S., in shelters. Our shelters are overrun with dogs and cats, but especially dogs who need homes. A lot of these dogs come from breeders, backyard breeders, or just any breeder that's breeding dogs and not finding responsible homes for them. And it's a huge topic. A lot of people in my type of position, especially like veterinarians, veterinary professionals, I think are nervous to talk about breeding at all because there are so many people who feel so strongly that breeding shouldn't exist. And I don't feel to that extreme about breeding. I think there are some situations and dog breeds that I want to go on. And so I do think there is a place for breeding dogs. And there are some dogs that serve certain functions. And I think breeding those dogs makes sense. And I think that no matter what I think or any other veterinarian or veterinary professional or person who works in rescue or shelter medicine feels, people are going to buy dogs from breeders. People want to buy doodles. people want to buy Labrador retrievers, the kind of dog I have. People want to buy certain dogs or own them or have them. And so no matter how we feel, what we say, what we do, people are going to go to breeders. And so I think it's very important that people like me and other veterinary professionals and people who do work in the dog space who are knowledgeable, I think it's very important that we do talk about, if you're going to buy a dog from a breeder, here are the things you should be looking for. And so I want to talk about that in a lot of depth on this podcast. And so if you haven't seen me talking about that on my page, it's coming. I am doing a lot of research. I'm talking to a lot of different people. It's probably going to be more than one episode. We're probably going to have at least one guest episode on this topic. So we are planning to talk about this in depth and at length. And I hope that you are excited about this, no matter where you fall on that spectrum of how you feel about breeding. And so my hot take, kind of leading up to that, is that we know that not all dog breeders are created equally. Some of them are very not great people. And at the same time, not all rescues are created equally. I've seen some sort of drama on the internet the last couple of weeks about rescues, dog rescues. I'm not involved in any of it, thank goodness, but I just kind of like fringe seeing what's going on. And I think this is something else that's important to talk about, because as a vet, I have personally seen unethical rescues in their practices. And so I just want to make sure also that people know rescuing a pet or adopting a pet from just any rescue that you can find on the internet is not always the best idea, because there are people in rescue who don't have the dog's or the adopter's best interests at heart. And so this is something else I want to talk about on the podcast. This is something else I want to give you advice about, because unfortunately, you can't just trust everybody out in the world. And I have seen firsthand what happens when rescues do not act responsibly and ethically, and or are just not trained or have the knowledge to be doing what they're doing. And of course, we want all dogs to have homes, loving homes. We want them to be off the street, and we want them to be safe and cared for. And of course, that's what rescues should be doing. But there are costs to dogs going in homes, and there are good ways to do that. And there are ways of doing that that are not good and are not responsible. So that's as much as I'll say for my hot take, because I want to be able to expand on this completely. So my hot take is that not all rescues are created equally either, and you should be selective about where you adopt a dog if you are going to adopt from a rescue. Okay. Here's what we're talking about today. I am starting a series where we talk about different dog breeds and cat breeds, and we're going to designate one episode per breed, or maybe 2 breeds per episode at the most. So this is going to be the first of many episodes. We're not going to do them all in a row. We'll probably just kind of sporadically do another episode in this series. But I want to basically give you a pet owner or potential pet owner of one of these breeds, whether you're going to buy them from a breeder or adopt them from a shelter or a rescue. I want you to hear the good, the bad, and the ugly about these breeds, so that you can go into having these dogs or cats in your home with knowledge, education, and preparedness, and make sure that this is the right breed for you. So I hope this is helpful, and we are going to just start with a bang. We're going to talk about a breed today that there's a lot to talk about. This is also the most popular breed in the United States of America right now. If you still don't know what I'm about to say, that breed is the Frenchie. So the Frenchie, their formal name is French Bulldog, is indeed the #1 most popular dog breed in the U.S. today. I personally know a lot of Frenchies. Clearly, I'm a veterinarian. I see a lot of them as patients. I have several friends that have Frenchies. I have some colleagues that have Frenchies. And I just want to start this episode by saying I love a Frenchie. They bring me joy when I see them in the clinic most of the time. A lot of my Frenchie patients are quite charming, And I can name just off the top of my head at least 10 patients by name and could tell you exactly what they look like because they just are memorable and hilarious and cute. So this is not a Frenchie bashing session. We are going to talk about a lot of issues that Frenchies have because that's reality. If you follow me on social media, you know that I make a lot of content that covers in some way, often humorous, characteristics of different dog breeds and cats. And sometimes I get accused of being unkind about a dog breed. I do talk about poodle mixes a lot, and people say I'm a doodle hater, and it's not true. But people sometimes get very defensive of the kind of dog that they have if they feel like I am saying or showing anything that's negative. And I just have to say, there's a very big difference in saying something that I feel is bad or just talking about facts. So we're going to talk about facts. We're going to talk about reality. Reality is not an insult. It just is what it is. I think it's really important that you do know all of these things about these breeds, especially before you go into being an owner of one of these. So Frenchies, man, they are hilarious dogs. So we're going to start with a little bit of just general information about Frenchies. I love history. I read a lot about the history of the French Bulldog. So we're going to talk about that. So you may assume that the French Bulldog originated in France, but they did not start in France. So the Frenchie is basically a result of the English Bulldog in England being bred into what was referred to as toy bulldogs. These dogs were, there was a group of mostly women in England who worked in lace mills. So these were women who made lace. They were known for having this fascination with these toy bulldogs. This was before the Industrial Revolution. So you had a lot of workers working in these textile mills, creating fabrics. And for some reason, these women who made lace, they loved these cute little toy English bulldogs who had more bat-like ears, unlike the bulldogs who had like the folded over crinkly ears, they referred to them as. So bulldog breeders started breeding them down smaller into this toy size. And then some of them had this a little bit different sort of miniature appearance with these ears, which is similar to what you see in a Frenchie now. So there was a large group of lace workers who had the earliest version of the Frenchie, the toy bulldogs. And then the Industrial Revolution happened and lace workers were not needed as much in this area of England. And so these women actually traveled to northern France where there was still a demand for that type of trade. And so they migrated to France. This was in the 1800s. And they brought their dogs with them. And so these dogs became popular in that area of France. What's interesting is that I read about brothels in this area of France. The sex workers in these cities really also thought these dogs were very cute. And so Frenchies were very well known in brothels. They were like brothel dogs. That's where they lived. And probably because of that, other people, different trades started seeing these dogs, deciding they wanted them. They were very popular in artist communities, fashionista communities, designers, and they were bred for truly companionship. So I couldn't really find a lot of history of them being working dogs, except for some reports of them being rat dogs, like they hunted rats. But they pretty much have always been companion dogs. They got to America because American tourists saw them in France and were like, oh, I like that dog. I want to take one back to America with me. It is reported that a Frenchie was on the Titanic when it sank. Interesting fact. So that is how the Frenchie began. So they are a descendant of the English Bulldog, started in England, got their name in France, which is why they are the French Bulldog. And now they are the most popular dog in America. So if you are listening and you don't really know what a Frenchie is, there's probably not many of you, but let me tell you, they are these kind of compact, often pretty sort of stout, muscular dogs. They do sort of look like a miniature bulldog as far as like their body composition. That's kind of what they look like. But their face is quite different from an English bulldog. They do have these standing up bat-like ears, and their faces are a lot more, I would say, expressive and narrow than an English bulldog. They are very quite brachiocephalic, like an English bulldog. If you don't know what that means, brachiocephalic means that their airway is shortened. So they have very shortened, wrinkled looking noses. And this gives them their very sort of famous and recognizable appearance. They do have a curly tail like an English bulldog or a pug, if you know about pugs. They do have very expressive eyes. And they are very loud dogs because, well, we're going to talk about it in a minute, but because they are so brachiocephalic, they have a hard time breathing, but they make a lot of like snorting sounds. Frenchies also just make crazy noises. We call them pterodactyls in our clinic. When they get stressed or sometimes excited, they kind of make this chirping, squealing sort of sounds, which can be very funny and entertaining, but that's what they look like. They are recognized by the AKC, the American Kennel Club. There are 4 colors of the Frenchie that are recognized by the AKC: brindle, fawn, cream, and pied. You probably have seen other colors of Frenchies. These are designer colors, so breeders will breed Frenchies to get these desired colors: blue, lilac, merle, chocolate. None of these are recognized by the AKC. A lot of that has to do with the fact that they are newer, kind of dilution or unique genetic variations of these dogs, and many of them are tied to health issues. So color dilution, like I mentioned, this is true of many dog breeds. When you start getting into genetics of breeding any mammals, there can be genetics that allow for color dilution. This is what gives you these sort of light brown or the blue-gray colors. But color dilution can be connected to different issues like alopecia, so they can inherently have hair loss. The merle gene, merle is a color pattern that a lot of dog breeds can be bred for, but they are also connected to a lot of issues. Deafness, eye abnormality, vision problems are common in merle dogs in most breeds, and Frenchies are not an exception to that. So that's what the colors that they come in. I would say we see a lot of brindle Frenchies and a lot of cream Frenchies and brindle. I would say those are probably the 2 most common colors I see in practice. I see a lot of Frenchies. They are, in general, very playful. They can be very friendly dogs. They're not always friendly, but they definitely have a lot of personality. They are often happy to be a couch potato with you. They do make good companions for people. A lot of people say, they love their Frenchies because they just kind of are happy to do whatever their owners are doing. And a lot of times that involves sitting on the couch watching TV, and their Frenchies are happy to do that with them. I did sort of crowdsource the internet for kind of people's thoughts on them. Some people said it's nice because they don't bark a lot, but I know from clients that there are some Frenchies who definitely are very vocal. So I think there are mixed reviews on that aspect of the Frenchie. But they in general, they can be very friendly dogs. I see a lot of families with Frenchies. They get along well with kids in general. Obviously, there are exceptions. I see a lot of Frenchies who have cat house companions and other dogs in the home, and they get along well with them. So those are some really good things about Frenchies. I would say they can make great companions. They can be hilarious little dogs, and I do find them cute. There are a lot of veterinary professionals who have said to me they're not even cute. I don't understand why people are so obsessed with them. I personally find them very cute, but not everybody feels the same way. It may be because of all the bad things we're going to talk about. So yeah, those are the good things I have to say about Frenchies. They are small, so they are compact for some people, that is a plus. I would say they probably don't require a ton of exercise to be stimulated, for their mind to be stimulated. So that can be a plus. So they may make good apartment dogs. I have known Frenchies to be destructive and have some anxiety. They definitely can be prone to separation anxiety because they can get very attached to their owners. So something else to know. But let's talk about the bad and the ugly of the Frenchie. And the reason it's important to talk about these things, because if you've seen Frenchies out in the wild, you're like, man, those dogs are so cute. They seem so funny. I want to get one. Hear me now. If you are thinking about getting a Frenchie, adding a Frenchie to your home, please listen to the rest of this podcast, because yes, they can be very cute and funny and sweet little companions, but they require money. They require a lot of financial planning. They require a lot of commitment when it comes to their health and their medical care. And if you are going to buy a Frenchie from a breeder, it is extremely important that you do a lot of research about what you're buying, who you're buying it from, and their genetic makeup. So we're going to get into all the nitty-gritty of that. So I made myself an outline because I wanted to stay on task and make sure I covered everything. So we're going to sort of break down the issues that we see in Frenchies by category. And so we're going to start with the big one, and this is BOAS, so Brachiocephalic obstructive airway syndrome. If you've never heard of BOAS, this is not unique to Frenchies. This is a condition or a group of conditions that we see in any of our brachycephalic patients. So remember, brachycephalic are dogs who have this smushed nose, shortened airway. And so dogs we automatically think of when we mention brachycephalics are Frenchies and English Bulldogs. Pugs are definitely brachycephalic dogs. Boxers are another one a lot of people don't automatically think of. They're not quite as brachycephalic as pugs, Frenchies, Bulldogs, but they can have some of these issues as well. So when we talk about BOAS, this is basically like it's a group of abnormalities, anatomical issues, abnormalities that these dogs can have. It is this system of issues that can lead to major issues for dogs. So the 5 abnormalities we see in dogs that have BOAS, and they don't have to have all of them, they can have just some of them, but this is what qualifies dogs to have BOAS. So stenotic nares or nares, some people say the nares or the nares are the nostrils, okay? So the holes in the nose. Stenotic just means that they're too narrow. So when you look like Cooper, for example, my dog who's a Labrador Retriever, he's a somewhat dolichocephalic dog. He has a long snoot, right? And his nares are very normal. So when you look at him from the front, you can obviously see the holes that make his nostrils, right? They're pretty round, very oval to round holes that he literally air goes through, right? So if you look at the nose of these brachycephalic dogs, Frenchies have really bad nares. They can be so narrow, they just look like a little slit in their nose, right? They just don't have an open nostril a lot of the time. So stenotic nares or nares is one thing we see in this. Elongated soft palate. So the soft palate is a soft tissue that's towards the back, the top of the mouth when you go straight back towards the throat. This is soft tissue that sits in that location. In a lot of these dogs, it is elongated, which means that soft tissue goes too far back towards the airway. And so it can literally hang over in front of the airway towards the throat. And this can block airflow and trigger gagging. These dogs, so that's number 2, elongated soft palate. Number 3 is a hypoplastic trachea. So trachea is the windpipe, and these dogs can have an underdeveloped trachea that can be more narrow or not as structurally sound. And so it's harder for air to move through that. So it's narrow, air can't get through. Number 4, everted laryngeal saccules. So this is tissue that's actually in the throat. And so there is chronic negative pressure, right, in the throat because of these other issues that I just mentioned. So all this narrowing causes more negative pressure when these dogs physically breathe. And this can put more pressure on these laryngeal saccules, these pieces of tissue, and they get pulled into the airway. So they're just adding more obstruction in the airway. And then number 5 is laryngeal collapse. And this is included because this is involved in a severe form of BOAS where these dogs actually have cartilage in their voice box, which is another part of their throat that can actually start to collapse. And that's their larynx. So they have laryngeal collapse, their larynx can collapse, and that actually can block their airway and make it so that they can't breathe. And that's the most severe kind of consequence of these abnormalities. So those 5 things are what are included to qualify a dog to have BOAS. And I would say that most Frenchies do have some level of BOAS. If nothing else, they're going to have some stenotic nares. And if you have heard of BOAS, heard that it can be in other dogs, if you don't know, I have some statistics. Frenchies are 30 times more likely to suffer from BOAS than other breeds. They are 42 times more likely to have stenotic nares or nares. And so if you are getting a Frenchie, whether you're adopting or buying a Frenchie, there is a very good chance that they do have some form of BOAS. They're going to have one or more of these abnormalities. And over time, these abnormalities lead to worsening issues with breathing. They put them at higher risk of emergencies that have to do with the respiratory system. And they are a really important aspect of these dogs' health, and they need to be addressed. So if you didn't know, there are some surgeries that veterinarians can perform to decrease some of the effects of these BOAS characteristics. 1 or 2 of them, stenotic nair revision. So most GP vets can open up Frenchies' nasal passages. So their nares, they can perform a surgery that opens them up a bit in the front. There are GP veterinarians who are qualified to alter that or shorten their elongated soft palate. So that's another surgery that can be done. There's another surgery to help with the laryngeal saccules. So people ask me about these surgeries a lot. And in our practice, I only do stenotic nares surgery because I don't have a surgical laser and I haven't been trained yet on how to fix soft palate. So I don't do that. There's an increased risk of bleeding in that surgery, and it's really helpful to have a laser. So I don't do that. My general recommendation for pet owners, Frenchie owners, brachycephalic owners is to go to a boarded surgeon to have those surgeries done. You want to address the nares and the soft palate and the saccules if you can. And so you want to go to a surgeon or vet who is qualified to do that. There are some GP veterinarians who are absolutely qualified to do those things. You just want to make sure that you are doing your research. You're determining what of those characteristics of BOAS your Frenchie might have and what surgeries could help them. I do tell people the earlier you can do those surgeries, the better, because like I said, these anatomical abnormalities worsen their actual respiratory condition over time. So the longer they're allowed to breathe with these tiny nostrils and elongated soft palate, and there's this pressure in their airway, the worse their other issues are going to get, like their everted saccules. So often those surgeries will be performed when those dogs are spayed or neutered at a younger age, under a year old. So I think that's a great idea. I think if you have a Frenchie, you haven't had them spayed or neutered yet, I would absolutely be talking to your vet about, are they BOAS? Do they need any of those surgeries to correct any of those abnormalities? And where would be best for you to have that done? That surgery is not cheap necessarily. I'm going to do a little breakdown of what it could cost to have a Frenchie, but it's definitely a big part of a cost you need to plan for if you're going to buy or rescue a Frenchie. All right, BOAS, brachycephalic is a big thing. Because these dogs are brachycephalic, a lot of them qualify as BOAS dogs. They have a really hard time handling heat, humidity, intense exercise. Do not get a Frenchie if you want a running partner. If you want a dog to go running with you, do not buy a Frenchie or a Bulldog or a Boxer or a Pug. They are not exercise dogs, okay? Most of them are not capable of swimming. They are very prone to aspiration pneumonia, and so you're not going to want to put them in the water. These are not dogs that are going to be out roughing, tumbling with you in nature, okay, for the most part. Obviously, there are exceptions to everything that I say. There's an exception. But in general, this is not what you look for in a Frenchie. They do need consistent monitoring. I have seen Frenchies suffer from heat stroke or get close to having a heat stroke in a building where the air conditioner went out and it was like 78 degrees in the building and they were a little stressed. So these are fragile dogs when it comes to their respiratory system and heat and stress and exercise. So these are dogs who need to pretty much live in air conditioning in a calm environment. Okay. And just one more thing about BOAS and their being brachycephalic. Some people think it's kind of like cute and funny that they make all these snorting, snooting sounds. It really is not funny or cute because all of those noises they make, they do snore when they sleep. They snort a lot. They do a lot of reverse sneezing. A lot of that is because of their altered airway. And so it's just a sign that they're having a hard time breathing. For some of these Frenchies, I've seen some who have such severe abnormalities in their breathing system. It's like kind of painful to watch them exist in the world because they just have such a hard time doing a basic function of life, which is breathing. And it's not cute. It's not funny. It's not cute. And it's probably stressful for them at all times just to pass air through their respiratory system. Again, like I said, I didn't specifically mention this, but they are very prone to heat stroke because if they get stressed or overheated at all, their respiratory system is not able to compensate for that. Dogs expel heat by panting, breathing, and it's hard for Frenchies to do that at all. So they just do not handle heat well at all. Okay, other health issues. I wish that BOAS, brachycephalic issues, were their only problem, but unfortunately it is not. Another big issue for you to know about if you're thinking about getting a Frenchie is IVDD, intervertebral disc disease. This is something we'll cover in its entirety in a podcast episode. Don't you worry. But Frenchies they're brachycephalic. They're also chondrodystrophic, and this means that the cartilage in their back around their vertebrae can age prematurely, and they can have this degenerative issue where basically the cushioning between their vertebrae can rupture because the whole structure is degenerating, and so that moves. It can put pressure on the spinal cord. It can cause pain. The vertebrae are not moving together the way they should. And a lot of these dogs suffer from IVDD, intervertebral disc disease. Cervical disc disease is really common in these dogs, so they get this in their neck a lot. There are estimates that 30% of Frenchies will develop some level of IVDD, intervertebral disc disease. IVDD can range in severity. It can just be a dog who has back pain periodically that can be treated with anti-inflammatories and rest. But IVDD also can be very, very severe. It can cause paralysis. A lot of dogs with IVDD end up needing back surgery with a veterinary neurologist or surgeon. And in Frenchies, there are a subset of these IVDD cases who can develop a condition called myelomalacia, which is often fatal complication in the spinal cord from these issues. So back issues are a huge problem in Frenchies. A lot of people don't realize this. I posted about this one time, like last year, and had several people comment that they had gotten Frenchies and had no idea that IVDD was such high risk in these dogs. So this is really important to know. If you didn't know, back surgery is quite expensive in dogs as well as people. Anything that needs back surgery, that's an expensive procedure, but you're looking at anywhere from $5,000 to $10,000 with a boarded surgeon to fix these issues in dogs with IVDD that suffer from paralysis. So that's just something that you definitely are taking a risk of needing when you get a Frenchie, and I think it's important that we talk about that. Okay, another common issue in these dogs is skin issues. A lot of these dogs have environmental allergies. They can also have food allergies. They do tend to be allergy prone dogs. It's estimated that about 18% of Frenchies do suffer chronic skin disease. This is often secondary to environmental allergies and or food allergies. Another thing that contributes to Frenchies having skin issues is that they do have a lot of folds in their skin because their face is basically like a, sorry, if you think about a dog like Cooper who has like a normal nose that's like this long, picture someone taking that and just smushing it together like a Ritz cracker pack. That causes folding, right? So when their nose is smushed up, there are folds of skin. If you look at a Frenchie or a Bulldog in the face, you'll see these folds, and they can kind of look like ropes along their nose. So these are folds of skin, and they can trap moisture and debris, and that is a breeding ground for bacteria and yeast overgrowth. So these dogs very commonly, a very large percentage of these dogs, whether they're even that clinical for it or not, do have some form of fold dermatitis. So they get buildup of bacteria, they get irritation, inflammation, yeast buildup in those folds. This can cause hair loss. It causes inflammation, which is uncomfortable. And they can have these chronic infections because of it. A lot of times, like I said, environmental allergies are the underlying cause. If you've ever had a dog with allergies, skin issues, this can be quite expensive because you're at the vet a lot getting this addressed. Sometimes these dogs have food allergies causing some of these symptoms. And so prescription foods, diet trials, homemade diets are used to help with that. And if you have any experience with that, it is not cheap to do all of those things. Another skin issue a lot of Frenchies have is they can have what's called screw tail and tail pocket infections. So they can have like a curly tail, and that can be somewhat inverted down sort of like in the fold of their skin above like their anus basically. And so that's another place that, like I said, moisture, bacteria, yeast can get trapped. You can find any of these issues with dogs who are overweight, which a lot of Frenchies are because, again, they're not running marathons with you. That just compounds this issue, and some of them do have to have surgery to remove part of their tail to open up that pocketing. So, again, skin, ear, allergy issues, really common in these dogs. Another big problem are eyes in Frenchies. This is another one a lot of people I think don't realize. I texted my friend Dr. Ben Bergstrom, who's a boarded ophthalmologist and owns a practice here in Nashville. I was like, any advice you have about Frenchies or just things you want to make sure people know? He said, I definitely think it's important for people to know that Frenchies are definitely in the top 5 dog breeds that are seen by ophthalmologists. I think he said that in his practice, it was the most popular breed they saw in 2024. So they have a lot of issues. I need to go back to my text with him and remember all the things he said they see. They do see a lot of these dogs with ulcers. They're very prone. Their eyes do stick out more than the average dog because of, again, the anatomy of their face. So it's easier for them to scratch their eyes. They also can have different issues that cause corneal ulcers. So a scratch or abrasion on the surface of their eye. They also see a lot of Frenchies with glaucoma. And so increased pressure in their eye. Glaucoma can be very expensive because you're seeing an ophthalmologist, you're keeping them on long-term meds. Sometimes those eyes have to be actually removed because the pressure can't be controlled. He definitely would recommend that if you are going to get a Frenchie, that you should basically get established with an ophthalmologist for your dog at a young age, because at some point in their life, you're probably going to see an ophthalmologist. They have, like I said, their eyes bulge, they have shallow sockets for their eyes. And so that just makes trauma as well as dry eye a lot more common. And they can have hereditary eye issues like cataracts and retinal issues that have been reported in Frenchies. All right, so far, breathing issues, skin allergy issues, eye issues, back issues. And then another big category of issues we see in Frenchies are GI, gastrointestinal. This is, again, something maybe that doesn't automatically come to mind when general public thinks about a Frenchie. But we do see a lot of Frenchies with some chronic GI issues. They can have food allergies. They can be quite sensitive. I see a lot of Frenchies with just kind of chronic GI upset, vomiting, diarrhea. We do see GERD, so gastroesophageal reflux in these dogs. Sometimes that is linked to, again, their anatomy. It can be worsened by their airway, pressure issues in their airway. So there are theories that some reflux can be created by that increased negative pressure in their airway, because if you didn't know, the airway and the esophagus are right next to each other and come out through the mouth near each other. So there can be some ties between those two things. They may have esophageal sphincter dysfunction, which could contribute to that reflux. And again, if you have a dog with reflux, you can definitely have to put them on prescription diets. See the vet often, sometimes consider meds to help with that. And again, it can be exacerbated by their airway issues. So the other kind of big category of issues that I wanted to mention, which doesn't apply to a lot of you, but if you are listening to this and you're considering breeding a Frenchie, which I personally would really not recommend to anyone. If you're thinking about that, just know that Frenchies are 9 times more likely than the average dog to require a C-section. I will just tell you that pretty much any female Frenchie that is bred is going to need to just be scheduled for a C-section. They really are not very capable of birthing puppies naturally. They have a really high rate of dystocia, which means birthing complications. So I feel like maybe we should listen to Mother Nature sometimes. If it's really hard for them to reproduce, I don't know. Maybe we should take the hint, but just something to be aware of. They can have some orthopedic issues. Hip dysplasia, patellar luxation are more common than the average dog, I would say, in Frenchies, but that isn't one of the biggest issues we see in them. But we definitely do see that. So those are sort of the big categories of issues you may run into if you're going to get a Frenchie. The cost of these things, I did sort of put together just a general estimate of, if you have a dog like a Frenchie who's more predisposed to these issues, here's what you might spend on that. So BOAS surgery, like we talked about, if you're going to have that done in addition to their spay or neuter or just on its own, depending on where you get that done, who does it, cost can be $1,000 to $4,000, even more in some cases. Like I said, back surgery for severe cases of IVDD can range anywhere from $5,000 to $10,000 with a boarded surgeon, which you're going to want. Allergy management, which again, very common in these dogs. We're talking hundreds of dollars a month for allergy management, whether that's medications, prescription food, homemade diet, frequent vet visits. Eye issues can be quite expensive. And then a lot of Frenchie owners would tell you, you might as well get to know your local ER because you're going to be visiting there with a flare-up of one of these things. And as we all know, emergency care costs more than general practice care because it is after hours. So, initial cost, if you're buying a Frenchie, you're obviously going to probably spend often thousands of dollars to buy them from a breeder. And then their annual care is going to be quite expensive. We're talking, probably more than $2,000 a year, with thousands of dollars in BOAS surgery recommended for a lot of Frenchies right from the get-go. Because of all of these issues, I would say that if you are planning to get a Frenchie, I would absolutely be planning on having pet insurance as well. Pet insurance can offset some of these costs, but it is also more expensive to have pet insurance for a Frenchie, just like it's more expensive to have car insurance for like a fancy European car that needs very specialty care. The same goes for a French Bulldog. So insurance premiums are, I think, about double that of just like a mixed breed average size dog. So anywhere from $80 to $150 a month for different plans is what I could find online. So pet insurance is not always cheap, especially for a dog like that. But if you spend $150 a month, but you are not responsible for 80% of their $10,000 back surgery, I would say it's worth it. And, all those frequent vet visits for one of 5 different very likely issues, they add up very fast. So I would say for Frenchies, pet insurance is basically not optional. I mean, it is optional, but I would never own a Frenchie without having pet insurance because there's just really no way to predict all the things that are going to go wrong. And this is just a plug for getting pet insurance early, no matter what kind of dog you have. If you're going to get insurance for them, you're going to want to do it when they're a puppy because most pet insurance plans do not cover pre-existing conditions. And so you're going to want to get insurance before those conditions start appearing. And that is especially true for Frenchie puppies because you're going to have issues pretty early on. I would say a lot of pet insurance companies are not going to cover BOAS surgery because that's a preventative surgery and their anatomy, I would guess, is considered a pre-existing condition. And so that's a huge cost that I think all Frenchie owners need to basically budget for before they even talk about buying that dog from a breeder. I would say Frenchies are one of, if not the most expensive dog in general to have, just because they are so prone to all of these issues. You can sometimes find pet insurance plans that will cover some congenital issues, chronic med surgery, things like that. So I would definitely be reading the fine print of insurance plans you're looking for. You definitely want to, compare quotes and plans from different companies. Okay. So if some more advice for you, if you are going to have a Frenchie or you're going to get a Frenchie, if you're going to buy a Frenchie from a breeder, I would do a lot of research into that breeder. If there's a breeder who they are breeding for these weird colors, there's a new fad, fluffy Frenchies, where they're breeding for this rare gene that makes their hair fluffy. Please, God, don't do that. Please don't buy fluffy Frenchies. Breeding for a rare cosmetic gene is usually a recipe for disaster. And if we just stop buying dogs from people who are doing that, then they won't have customers anymore. So please don't buy fluffy Frenchies. Okay. Regular Frenchies have enough problems as it is. I would avoid buying these rare colors, the color dilutions like the lilacs and the merles. And the chocolates, I think, is another rare color. You want to find a breeder who does as much health testing as possible, as much testing, vetting that's been done in their parents, in their aunts, uncles, grandparents, siblings as possible is going to be helpful. And if you are going to adopt or rescue a Frenchie, same issues apply. A lot of Frenchies who are in rescues or shelter situations have come from an unethical breeder. And so they are going to have issues. And so if you are going to rescue a Frenchie, God bless you. Thank you for doing it. I just want to make sure you are signing up for the same things that I just talked about. A lot of times if you're rescuing or adopting a Frenchie, they're not a puppy. They're a middle-aged Frenchie. And so they probably are coming with some already established issues. Find a vet that you like. Find a vet that you are going to be comfortable seeing a good bit. And, you want to budget and plan for these dogs. There are some people, I have some of my best clients are Frenchie owners. They knew exactly what they were signing up for. A lot of them have adopted Frenchies, and they knew that they were adopting an expensive and high maintenance dog, and bless them, because I want those dogs to have homes too. But they knew what they were signing up for. And so, they're not surprised when I tell them, all right, we're going to do this. And then I need to see you in 2 weeks. And I'm probably going to see you every 2 weeks for the next 3 months. And if this doesn't get better by your next recheck, we're going to send you to the ophthalmologist. They're prepared for that. And they know that. I have so many Frenchie owners, clients who are amazing, pet owners, but the best ones knew exactly what they were signing up for. This is a sort of a big topic and an ethical question. Sometimes people say, should Frenchies even exist? Is it right for us to even support their existence? Because as a breed, they can't even really reproduce safely. They're so prone to so many issues that are so expensive. And I relate to that sentiment. As a veterinarian who sees these dogs be, sick a lot and their owners have a hard time paying for that care and being at the vet's office all the time. Sometimes when I see someone with a new Frenchie who I can tell maybe didn't really know what they were signing up for, it's hard, and I feel for the people, I feel for the dog, and it's a fair question. Should these breeds exist? What I wish is that we could work on, if someone's going to keep breeding these dogs, we breed for better anatomy. That would be my hope. And so I do think it's important, the more that you as a pet owner, potential Frenchie owner, know that just because, their real smushy face looks cute doesn't mean it's even if you think that's cute, it's not good for the dog. So as little smushing as possible, or less of that is better. Less brachiocephalic is better. Dr. Bergstrom also told me, he was talking to someone in the Frenchie world who was saying that now breeders are breeding these dogs with Shar-Pei in them, so they get a bigger rope, so that big fold of skin that's over their nose. For some reason, there are people who like the look of that, and so they breed for that. And, that's frustrating to hear, because that's just issues. You're breeding for medical issues. And so I understand the sentiment that, that shouldn't exist. I agree. That shouldn't be happening. So that's what I want. So those are the big things I want you to know about. If you're thinking about getting a Frenchie, these are the things to plan for. These are the things to be aware of. It's okay to say, I want to have a Frenchie. And then you maybe hear this podcast or you read something about this and it's okay to go, okay, I cannot afford a Frenchie. If you cannot afford to pay for pet insurance or have a savings account with thousands of dollars in it saved for your Frenchie, it's probably a risky decision to get a Frenchie puppy. It just is. That's just the case. If you want a dog that has the look of a Frenchie, I would say maybe a boxer is a better solution, a Boston Terrier maybe, but they have issues as well. Not as severe as the Frenchies, but and some people would say go rescue a dog that's a Frenchie, but that's the same as buying a Frenchie. And so I think it's important, no matter whether you're buying or adopting a dog, it's important to know what breed you're signing up for and what issues you're signing up for. So there's a lot to think about and consider and budget for if you're considering these dogs, who, when they're my patients, I love them very, very, very much. And I think they're hilarious. And I love them as my patients. But this is the harsh reality of these dogs. So I did a thing. I put up a question poll on my story today and just said, hey, I'm going to talk about Frenchies on the podcast. Give me your thoughts, advice, thoughts. What do you think? So I got a lot of answers. So I just wanted to share some of them with you. This is what the people have to say. So Senior Pet Vet, who's a friend of mine, she did say, as a Frenchie mom and a vet, they need BOAS surgery. It shouldn't be optional. And she's right. Almost all of these dogs at least need stenotic nares surgery. But again, that should not be the only surgery that's performed. They need to be evaluated to see what anatomic abnormalities they have and what surgery would help them. Another follower who's a vet, Dr. Melissa Kearns, said, please get insurance. They are hilarious. I agree with her. They are hilarious, but be ready to pay for brachiocephalic surgery. All right. I do have a friend also, Callie Flora Foster. She sent a couple messages And she says, so Callie fosters a lot of dogs. She has fostered 11 Frenchies now. And she says that, I won't read her wording exactly, but she's like, she wouldn't do it because she's fostered them and she has seen the issues. Her parents have adopted a couple of them, but she said, if you don't have money, please don't do it. And I have to agree with her. This is not a dog for anyone on any type of limited budget whatsoever. Someone else said, just don't do it. Another friend of mine said, love Frenchies, hate the culture. As creatures, they are wonderful, but used by our culture. So this sentiment I agree with. And I think what this person is really saying is that, they exist, right? People have bred them. They exist. We love them. They are wonderful, hilarious creatures. But our culture of breeding these dogs to look a certain way has created these horrible medical problems for them. And we hate that. And I think this is the sentiment of a lot of people in the vet profession. A lot of us have Frenchies. I think it's great for vet professionals a lot of them adopt Frenchies. And I think that's great because we can provide the medical care that they need. And so, a lot of vets have them and they love them because they can be hilarious, just wonderful dogs, but they require a lot. Let's see. Here's another vet said, have an ophthalmologist on speed dial, like I said, and be prepared that they do not do as well as others. Get pet insurance, someone said. Let's see. Someone said, they're just not cute. There is nothing cute about back issues and not being able to breathe. Again, I do find a lot of them to be cute and they have cute personalities, but she's right. It is not cute for these dogs to have breathing issues and back issues. Make sure you budget an extra $6,000 to $8,000 for all the surgery they will need. Get pet insurance from a young age. Agreed. Get pet insurance. Someone said, here's a positive one. Frenchies are the best low energy family dogs out there, but expect monster vet bills. I agree. I don't know that they're the best family dogs, but they can make good family dogs, but they are very expensive. Okay, let's see. Someone did say, how can God create such a cute little dog riddled by health problems? My answer would be, I don't think God created the Frenchie. I think that humans have created the Frenchie. Let's see. Someone said they are amazing if you go to a reputable breeder. I'm going to be honest. I don't see a ton. I don't have many Frenchie patients that don't have health issues. That's what I'll say. Someone else said, let's see. What did someone else say? Anyone wanting to breed them or similar breed, high rate of C-sections in these large-headed breeds. Yep, again, they cannot reproduce on their own very well. Someone said, insure that little mofo and live near a neurologist. Agreed with that. Let's see. Someone said, if an owner is dead set on obtaining one, insurance, savings account, line of credit. This is just a broken record. All right. Everybody's saying the same thing. Someone said, why do they fart like that? I have heard some hilarious Frenchie farting stories. Someone did ask, are they prone to cancer? What is their average lifespan? I didn't do research on this before this episode, but I would say, just like, this is me just talking, there's no statistics behind this. I would say that I feel like maybe cancer is not high on their issue list. I would say there's a lot of other breeds, pure breeds, that are a lot more prone to cancers than Frenchies. They can get mast cell tumors. But I would say, they're not dogs that I see with a ton of like terrible cancer diagnoses. Average lifespan, I don't know. I didn't look this up. I don't know what the current numbers are, but I would say because of their airway issues, a lot of them have issues, big issues as they age. If they live long enough, I'd say they're going to have IVDD or some type of significant airway issue, but I would guess the average lifespan for Frenchies is around 12. I don't know. Someone should tell me. I can look it up. We can put it in the show notes. But I would say, I bet it's around 12. Someone else asked life expectancy, and I'm guessing that's what it is. Lots and lots of answers. Please get pet insurance. Someone asked about fluffy Frenchies. They said, are fluffy Frenchies actually a Frenchie? Or are they crossed with something? Are they healthy? So I did do some research about the fluffy Frenchies. I did read, like I said, it is a recessive gene that was isolated. Some Frenchies probably threw a fluffy Frenchie. So I bred their Frenchies. This is usually how weird things like this happen. Someone bred a couple of Frenchies. They had puppies that had this different coat. The fluffy Frenchies have like a longer coat. They look fluffy. And they were like, ooh, we should breed those dogs to make more fluffy Frenchies. And so what actually has happened is they've identified some type of recessive gene where if two dogs carry this gene and they have the right mating, it creates these dogs. And so then they perpetuate that genetics or those genetics by breeding those dogs together. This leads to a lot of inbreeding, and there can be health issues connected to these rare genes. So in general, this is not recommended in breeding practices. And so at the end of the day, the moral of the story is please, please, please do not buy one of these fluffy Frenchies. Do not support this. Okay. Someone also asked, are they always grumpy towards other dogs? I definitely have seen some Frenchies be a little bit reactive, territorial, not do well with other dogs. But in general, I would say they're fairly friendly dogs. Another thing a couple of people have mentioned about anesthesia. I didn't really talk about this just now. I should have. So the cost for just regular surgery, any type of anesthetized event in a Frenchie, can be higher. And that's because when we as veterinarians anesthetize Frenchies, if you didn't know this, or any other significantly brachycephalic dog, there are precautions that we take because these dogs are a lot more prone to, one, just like cardiovascular respiratory issues while they're under anesthesia because their airway systems are already compromised. And so there are precautions we take for that. They are, like I said, more prone to aspiration pneumonia and reflux. And so there are different medications that we give. There are different ways we actually anesthetize them that helps to decrease the risk of side effects from anesthesia in these dogs. So that's something else that you as a pet owner may not be aware of. And I've had people tell me, why does my Frenchie's spay cost more than another dog's? And that's why, because they're just automatically being brachycephalic, it increases their anesthetic risk. And so there's just different precautions that have to be taken for that. So if you didn't know that, brachycephalic dogs, Frenchies, pugs, boxers, bulldogs, some Bostons, different dog breeds can have increased risk under anesthesia. And so they need different protocols, different medications, and that can cost more. Oh, here's the one. Coming from a vet assistant, please clean their face folds. I have some dermatologist friends, Dr. Julia Miller and Ashley Bourgeois, who talk about this, but skin fold issues are so common in Frenchies. One way you can help prevent some of the severe secondary issues from them is really good hygiene with their skin. So you can get wipes and just clean their facial folds out on a regular basis to prevent that buildup of debris. Sometimes we do perform surgery to decrease the depth of those folds. So we'll do some cosmetic surgery to take some of that excess skin away. That's something else that happens. Oh, another thing, if you to follow me, this is one of my most favorite things to talk about. I see quite a few Frenchies with hooded vulvas. That's extra skin folded over their vulva in female Frenchies. This is just another thing that can be a skin issue that can make them prone to chronic urinary tract infections. There is a surgery to fix it, but it costs about, I don't know, $1,000-ish, $1,200 at our practice. So that's another thing. Okay. This has been the good, the bad, and the ugly about Frenchies. I would love to hear your thoughts about this. If you feel like I forgot something really big and important, please let me know. I didn't mean to focus on the bad and the ugly. There just is a lot that can be seen as negative about Frenchies because they do have issues. But there's good too. They're hilarious little dogs, and I do like to impersonate them in my dog breed skits. I hope you all find this helpful. We're definitely going to do this about other dog breeds. I'd love to know what breeds you want to cover. We're going to do this about cat breeds as well. I know the cat people think I'm leaving you out. I'm not. We have cat content planned. So be on the lookout for that. Send me your questions. Send me your follow-up comments. Let me know what you think. Make sure you're following Dr. Molly Says Pod so you can see clips from our episodes. Follow us so that you can download our episodes wherever you listen to podcasts. And make sure you leave us a review if you're enjoying the podcast, and subscribe so that you never miss an episode. This has been another episode of the Dr. Molly Says Pod. Thanks for being here, and we will see you and talk to you next week.